So here you are watching Coblation tonsillectomy in a 9-year-old child with history of recurrent tonsillitis. So I'm doing an extracapsular tonsillectomy. And this is the left side. So left is definitely a little odd for a right-handed surgeon. Now you can see here that I'm trying to get into the plane, and at this point the wand is not faced towards the tonsil, it's actually facing on the lymphoid tissue, on the connective tissue, which is connecting the lymphoid tissue with the muscles. So it is actually directing laterally, not medially. But this is only till I get the correct plane. Once I have got the correct plane, in the lux process, now that's the correct plane. Once I have got the correct plane, we try to keep it in a place where the glare is minimum. What is important is not to go there and not to go there. We have to be in the exact correct plane, which is the connective tissue. Now these are the few vessels which I am coagulating. Connective tissue. You see, the tonsil is really fragile. I am trying to catch hold of the tonsil. Very fragile. But I have to be in the correct plane. And there are some cotyledons which are actually buried. I should not damage the muscles in process of taking out those cotyledons. Alright. Now, again getting into the correct plane. Alright. Very carefully, not getting into the muscles because that will be painful for the child later on. Little bit of this cotyledon dissection, making sure that I'm not opening up the muscles. Alright. Can you see that small vessel? I'm coagulating that vessel. Trying to remain away from the muscles. So I have to go intracapsular at points, but I'll make sure that I do not leave behind any active lymphoid tissue. Alright. Now I'm again going intracapsular here, but I'll not leave behind tissues. So it will finally become an extracapsular surgery. It's only to avoid exposure of the muscles and thereby pain and bleeding. Right now I'm at the lower port. Can you see that? So the lymphoid tissue, the tonsil has ended over here. There's a little bit of lymphoid tissue which is at the junction of the tonsil and the lingual tonsil. I'm ablating that tissue as well so that it should not cause any problem later on. At the same time, not opening up the blood supply. Then again, very carefully, because I'm already at the lower pole of the tonsil. Let me, I have gone a little bit intracapsular, as you can see. It's called hybrid tonsillectomy. And make sure that the child does not end up having a lot of pain and bleeding. Alright, so far I have not encountered the tonsillar artery, but it can come anywhere here. I have to make sure that there is no bleeding from the tonsillar artery later on. I'll coagulate along the course of the tonsillar artery and then divide at the most medial aspect. Alright, that's called hybrid tonsillectomy. But this is essentially an extracapsular surgery, because I'm not leaving behind any lymphoid tissue. Alright, alright. So this tonsil is out. In a moment, I'll show you the tonsil fossa. It's coagulating. Now you can see the tonsil fossa, which is almost covered by fascia everywhere. Right. So despite being in extracapsular surgery, there will be hardly any pain or bleeding. Thank you for watching. Yeah,